Hi, good morning, Elvis. My name is Mihiraa. Let's start the warm-up session. What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your role play.
Mihiraa, thank you for holding Kevin while I had a gentle look inside his mouth. I can appreciate how worrying it is when your little one is in pain and won't eat. So let's try to get to the bottom of this together. Mihiraa, I'd like to start by finding out some specific details about this ulcer. Can you tell me, in your own words, the whole story of how this ulcer?
Thank you, Russell. It has been so stressful. The ulcer appeared about 2 days ago, right on the inside of his lower lip. He has never had one before, so this is all new to us. I don't think he injured his mouth, but he is just so miserable and cries whenever food touches it. I tried putting a tiny bit of regular adult mouth gel on it yesterday, but he screamed because it stung, so I washed it out immediately and haven't tried anything since.
I hear you, Mihiraa, and it must have been heartbreaking to see him react that way to the gel. You were just trying to soothe his pain, so please don't blame yourself. Now that I have a clearer picture of the onset, I need to gather some broader information regarding Kevin's overall health so we can ensure he stays safe while we treat this. Could you share with me how he has been feeling generally and relevant habits, please?
Generally, Kevin is a very active, happy, and healthy 5-year-old who eats well and loves to run around. He usually has a great appetite, enjoys drinking water from his favorite bottle throughout the day, and maintains a good daily routine. He is also quite cooperative with his regular oral hygiene and lets me brush his teeth twice a day without any fuss at all. It is just right now, because of this painful sore, that his usual habits have completely changed, and he has become so quiet, irritable, and fearful of anything touching his mouth.
Mihiraa, thank you for trusting me with these details about Kevin. I want to help put your mind at ease by explaining some very common, everyday reasons why a child might get a mouth ulcer, so we can think together about what might have happened. Often, these sores come from simple little accidents that happen without anyone even noticing at the time. For example, a child might accidentally bite the inside of their cheek or tongue while eating or playing, or they could get a tiny scratch from a hard toy, a toothbrush that is a bit too stiff, or even a sharp edge of food like a cracker. Another possibility is a mild burn from a sip of hot soup or a bite of food that was warmer than expected. Sometimes, certain foods like very sour candies, oranges, strawberries, or tomatoes can naturally irritate the soft lining of the mouth and lead to an ulcer. None of these causes is serious or unusual, and they all heal on their own. Do any of these specific scenarios sound like something Kevin might have experienced recently?
Now that you mention the hot food, he did try to eat some hot chicken soup 3 days ago and complained it was too hot, but he didn't cry much then. It's possible he burned the inside of his lip, or maybe he accidentally bit himself while trying to eat it. It makes sense that a small injury like that could have turned into this nasty ulcer.
That is a very helpful clue, Mihiraa, and it is highly likely that a mild burn or a subsequent accidental bite from that hot soup created the initial raw spot that developed into this ulcer. Beyond physical injuries, I should also explain some of the medical and lifestyle factors that can cause mouth ulcers in children, so you are fully informed. Sometimes, these ulcers are caused by common viral infections, or they can be recurring ulcers that pop up with no known specific cause, often triggered by temporary patches of stress, changes in routine, or poor sleep. To help Kevin feel much better immediately, I would love to recommend some gentle home remedies that you can implement right away. I suggest switching to an ultra-soft toddler toothbrush and using only water to clean his teeth for a day or two, so we don't irritate the area, while focusing heavily on offering cooling fluids, milkshakes, or even fruit popsicles, which will soothe the raw tissue and keep his hydration up. It is also vital to strictly avoid any acidic, salty, or spicy foods that could sting the ulcer. Mihiraa, please let me know if you have any questions or concerns.
Those ideas sound wonderful, because I know he won't say no to popsicles, and it will at least get some liquid into him. I will definitely get an ultra-soft brush today and stick to bland, cool foods. What else can we do medically if the pain is still too much for him to sleep?
Mihiraa, to provide Kevin with stronger pain relief, I would like to outline the medical treatments that our clinic doctor can prescribe for him today. The doctor can assess Kevin and recommend a child-safe, soothing topical gel formulated specifically for 5-year-olds to numb the area before meals, alongside prescribing appropriate doses of pediatric pain medications like paracetamol or ibuprofen to keep him comfortable. Because these targeted treatments require a formal prescription, I would like to establish your consent to book a short appointment with our doctor right now so we can get Kevin this necessary relief.
Yes, please. I would absolutely like to see the doctor. Anything that can safely take the pain away so he can eat and rest is exactly what we need.
I am so glad you agree, Mihiraa, and I will book that appointment for you immediately so you don't have to wait long. Before the doctor sees you, let me quickly summarize our discussion today to ensure everything is perfectly clear. We have established that Kevin's ulcer likely started from a minor injury or hot food burn a few days ago, compounded by the stress of your recent move, and that he is currently struggling with fluid intake and oral hygiene due to the pain. To manage this at home, you are going to focus on offering cooling fluids and popsicles, using an ultra-soft brush with water, and avoiding irritating foods, while the doctor will shortly evaluate him to prescribe a child-safe, soothing gel and pediatric pain relief. Please take a deep breath. You are doing a wonderful job as a mother, and we will get Kevin smiling again very soon.